In 2022, I had tonsil cancer, 25 days of radiation, full hysterectomy, and a hip replacement. I have a few things that I learned that people don't stop to take into consideration. I have friends who, over the last couple of years, have had some health challenges. I have a girlfriend who actually just had anal cancer and she had to have chemotherapy. I only had to have radiation. Now I have another friend who's a dude who has breast cancer and he's in the middle of radiation. And what it really makes me think about is the process is very disruptive. Even if you're not feeling bad, even if you're getting everything done, you're barreling through it like I was, the process is very disruptive because there's always a reason to go to the doctor. You either have a test that you need to take, they need blood, somebody wants an x-ray, somebody wants a scan, somebody wants this, somebody wants that. So in the middle of trying to run your life, manage your family, go to work, in between all of that, you got to take off work, you got to change your appointments so you can go back and forth to these doctor's appointments. So that was the first thing that I realized was how disruptive it was. And for me, it was disruptive for a whole year because I had my tonsil cancer surgery in April. I started the radiation in May. I had the hysterectomy in August, and then I had my hip replacement in November. So not only are you ending one process, you're starting another, but at the end of that process, you still have all these tests and things. So I have a few things that I learned that people don't stop to take into consideration. Number one, the whole process can be very intimidating because a lot of us have grown up with this idea that doctors are gods. They're not. And as Stewie says, they're just people plumbers, okay? What I want you to remember, if you're going through the journey yourself, the first thing you should recognize is that not all doctors got A's in school. This is really important. You can get an A, a B, a C, and probably some D's and still be a doctor. This is number one, so you have to remember that. So the moment you go in there, you're an accountant, you're a lawyer, you're a personal trainer, you're a great mechanic. You have to honor your own expertise and recognize that the doctor might be good, but if you don't check them out, you won't really know. That's number one. Not all doctors got A's in schools. Number two, some doctors are only doctors because that's what their parents wanted them to do. They don't actually even like what they're doing. They're just doing it. Some of them wanted to be musicians, but instead they went to university, got out of school, became doctors, and they're miserable every day. And now they're taking it out on you. So recognize that. Number three, it's really important to ask the tough questions, not to take everything that they say in face value. The toughest question I asked my doctors when I went, because I'm an African-American woman, and because we hear all these statistics, which are true, about women of color, especially African-American women, dying on these operating tables. And I remember when my bestie and I were going to Fred Hutch, and when we went to the first meeting with the doctors and stuff, and we were sitting in the room with the nurse, when we drove up, there was a big sign on top of the building and it said Black Lives Matter. And I looked at her and I went, whew, maybe I'm gonna be okay. So we get in there and I asked the nurse, I said, just in case you didn't know, don't let this blonde hair fool you. I am a black woman. Am I going to be safe in here? She said, yes, you're going to be safe in here. There are very good doctors. The care is excellent. I said, okay, I'm just checking because I don't want any surprises. When I got my doctor for my hysterectomy, amazing doctor, her name is Dr. Brooke Winter. She's here in Seattle, and I chose her. I wanted her. But when we had our meeting, I said to her, now, Dr. Winter, let's just get the elephant out of the room. I am a black woman, And Black women are dying in these hospitals in inordinate numbers. If you don't like Black people, just tell me and I'll find another doctor. Those are tough things to say. But the thing is, once you've said it, first she was startled and then she said, no, we understand. We're paying attention and you are safe with me. She said that to me. And at that moment, I knew, because she knew, I knew that she knew that I knew that she knew. And so I felt like I was in good hands. And I knew the fact that I had said that meant that she was going to communicate that to her staff. Whether she communicated it as a joke or whatever she did, she was going to let them know this woman is concerned about our care as it relates to the fact that she's an African American woman. Yes. So number one was remembering that not all doctors got A's in school. Number two is ask the tough questions, get the elephant out of the room, and level the playing field. Number three, announce when you go into these meetings that you are going to be recording the session. Yeah. And some of you are going to say, can you do that? And I say, why couldn't you? Why couldn't you? And here's the way you do it. With the first big cancer meeting, it's like you're asking permission, but you're really not because you're going to do it anyway. And I have my phone. I hope you guys don't mind if I record this because there's just no way I'm going to remember everything you say. And once I get home, I'm going to need to listen to it again so I can put down my questions. Nobody said a word and everybody started talking. I recorded the whole thing because let me tell you something. You get in those meetings, especially you have something like cancer, but it could be anything, cancer, diabetes, whatever it was. For me, it was tonsil cancer. You get in those meetings and they say things to you. And if anybody has been through it, please share. They say something to you and it's like that movie, The Eyes of Laura Mars. You can't see anything and you're stuck on what they just said, but they're still talking and they've gone on, right? And so that is the reason to record the sessions that you have with your doctors. I did the same thing with my hip surgeon. And the other thing is my Stewie, my partner, is in Britain. When I get home at night, Stewie calls me. He's going to say, well, what happened? What'd they say? And I'll be like, I don't know. It's just so like, I don't remember what they said. I remember some of it, but I don't remember all of it. So that was a great way for me to be able to remember. And nowadays, what is so fantastic is if you record it on your phone, you come home, you send the recording from your phone to your laptop, load it up in TurboScribe. It takes the recording and transcribes it. And then you can take the transcription, click the button to connect it to ChatGPT, and you can say, please share with me the important things that were mentioned, any steps that I need to take, any things that I need to consider, questions that I need to have answered. Zoop, 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 zoop. Now you can share that with your partner, your spouse, your bestie, and that kind of thing. So number two is announce that you're going to record the session so that you walk away from that. And even during those moments of pure deer caught in the headlights, when you get home and you listen to it, you're like, I didn't even hear him say that. Yes, but now you've heard it. Number three, do not allow these doctors, if you've had a surgery or something, don't allow them to just walk in the room and start talking circles around you with words that you don't understand, language that you don't understand because it's doctor speak, medical speak, or even not introducing themselves. My bestie, Alibaba, will tell you, when I was in the hospital at UW, the doctors came in the day after my surgery. I got all kind of tubes coming out of here, stuff all over my head, all kinds of stuff. Gross. It's like 6 o'clock in the morning, 7 o'clock in the morning. They're on their morning rounds. And they come and they stand around my bed, like 6 of them. And they start talking to each other, right? You have to take your power back. You have power. You have to use it. And when they came in my room and started, I said, excuse me, excuse me, would you care to introduce yourselves? They looked at me like I was crazy. But after they got over the initial shock of me having an expectation of them, guess what they did? I said, how about you first? You are? Oh, I'm Dr. Such and Such. And what do you do? Okay, and you are, and you, and once they'd all introduced themselves, then they were standing there and they'd start talking. I'd say, now what exactly are you talking about? Oh, okay, well, Miss Wright, such and so on and so forth. You have the power to do that. You can stop the conversations that people are having around you that you don't understand, and you can say, excuse me, could you please explain that to me? My famous line is always, I'm going to need you to start over and explain that to me like I'm a 10-year-old. And so what I'm telling you is the same is true when you're dealing with doctors and nurses. What else did I write down? Oh, I meant to say, you don't know what you don't know. And whatever you don't know is costing you time, money, or both. But in this case, whatever you don't know will be costing you time, will be costing you money, and it could cost you your health. That was number 3. The 4th thing I'll say is this. Do not think that you don't have a choice when it comes to your caregivers. You have a choice. Just because somebody suggests a doctor to you doesn't mean you have to accept that doctor. Doesn't mean you can't change that doctor. Now, I'm sure that there are some instances where, for instance, if you have Kaiser, if you have that kind of plan, you may not have as many options as you would have if you had Blue Cross Blue Shield or US Health or something like that. But if you do have a plan like Blue Cross Blue Shield and they tell you, well, this is the doctor we picked out for you, you can say, well, you know what? I'm going to do my research and I'll consider him. We can go ahead and set up the appointment, and that will give me an opportunity to do some research, and I'll get back to you. Because let me tell you something. When I found out I had cancer, I was in the United Kingdom. It was 8 days after I got in the United Kingdom that I got a phone call saying, oh, you have cancer. I'm like, oh, okay, all right. And it was just like I said. I felt like a deer caught in the headlights. Like I heard what she said, but I didn't hear whatever she said after that for maybe the next 30 seconds sounded like wah, 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 wah. And then I tuned back in. She gave me some information, gave me some doctor I was to call or something. I called and I was supposed to get a call back from that doctor. 2 days later, I had not even heard from that doctor. Luckily, I have friends who are doctors and I have friends who work in medicine that are in administration. I called my friend. She said, listen, if you can get with Seattle Cancer Care Alliance, if whatever insurance you have will allow you to do that, that's what you need to do. I hung up the phone. I looked up Seattle Cancer Care Alliance. I called them. I didn't know what to say. And I just said, I don't know what to say except to tell you that I have tonsil cancer. And the whole experience from the moment I made that particular phone call, everything changed. They were the kindest. They were the most thorough. I had a doctor. I had a team. I even had an advocate for me that was part of Blue Cross Blue Shield that was right there on the premises. So what I'm trying to say to you is don't be hasty. If you get a diagnosis for something, you at least have 2, 3, 4 days, especially if it's cancer, before you need to do something. Gather as much information as you can. Tell you what I do. Like right now, I've been noticing that my eyes are getting worse. And so do I need an ophthalmologist? or an optometrist? Do I need a test for cataracts, glaucoma, or do I just need an eye exam and better glasses? The first thing I did was search for what is the difference between an optometrist and an ophthalmologist. The next thing I always do is I say, who are the top 3 ophthalmologists in Washington State? Who are they? Because I am not going to let them say, oh, go to this guy. No, I'm going to go to the guy I want to go to. The top 3 doctors. And tomorrow I will start making my phone calls. So what I'm saying to you is don't settle for less than you have a right to. Don't do it. Look for the best. Expect the best. Don't we say it all the time? I know I deserve the best, blah, 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 blah. And then you start talking to a doctor or some other kind of professional and you think they know more than you. They do, but they only know more than you about the subject that they are an expert in. And you have to remember that you are probably an expert in something. And if you are as qualified and expert in your field as they are in theirs, and they couldn't do your job and you can't do theirs. So ask lots of questions. Search for the best doctors. Call them. Find out if they accept your insurance. Find out when you can get an appointment. If you're in America, make sure you're checking into your My Chart, because those records can be shared with other doctors and you can do the sharing.